Hello, everyone. My name is Melanie, and I just wanted to jump on here and bring attention to an issue in our community with people taking medicine and don't know what or why they're taking it. It really bothers me to see a healthy cognitive or a person that is perfectly capable of understanding things but just won't. It happens far too often. Almost every day I'm at work that I can ask a person, "Do you take any medicine?" And their response will be something like, "Yeah, I take about 10 pills a day." "Well, what medicines do you take?" "Well, I don't know the name of them. My doctor gave them to me and told me that I need to take them, but I think I take something for pressure." "Well, what other medical issues do you have besides high blood pressure that you know of?" "I don't know. I think sugar and pressure. That's it." Then we can check your pressure and it's like 240 over 130. And I'm like, "You think you have high blood pressure?" "Oh, it's always like that." Well, it shouldn't be if you're taking blood pressure lowering medications and about 10 pills a day. "Oh, well, check your computer system. It should be in there what I take. I'm here all the time. They know me." Well, it may be in our system and it may not be. But before we can get to that, I'm going to need you to know what's going on with you, that you have to take so many pills a day, and know that either sugar, which is diabetes, or high blood pressure can take you out if not treated appropriately. And with the blood pressure 240 over 130, you're a walking time bomb that can stroke out at any time. High blood pressure is also known as a silent killer because most people don't have any symptoms. So, I'm going to need some of you all to do better when it comes to your health. And that starts with just getting an understanding of what's going on with you, what you're taking, and why you're taking it, and how it's supposed to work. You shouldn't have to be taking just whatever someone prescribes you without knowing what you're taking and, some of the side effects of the medication. Um, because some of the chief complaints that you all have when you come into the emergency department could very well so be related to the medication that you're taking. For example, lisinopril, also known as a ACE inhibitor. Lisinopril is a very common blood pressure lowering medication that have a well-known potential life-threatening side effect called angioedema. Angioedema can cause swelling, extreme swelling of the lips, of the tongue. It can include the airway, shortness of breath. Like I said, it's life threatening. And if you ever know that you have any of these signs or symptoms, you need to make your way to the hospital or emergency department right away. Okay, so know what's going on with you. It's your right to know. Yes, doctors and nurses are supposed to educate you on this, but when they do, if you still don't understand, if you still have questions, or you're still not sure, ask questions until you do know. Because at the end of the day, it's your body and your responsibility to participate, to ask questions, to comply, to educate yourself, and take ownership of your care. Don't expect anyone to care more about your health than you do. If you are forgetful, if you have a hard time remembering things, or can't pronounce the name of some of these long, lengthy medications or diagnoses, we get it, and that's okay. Try writing it down. Take a picture, keep a list in your phone, in your wallet, next to your insurance card or your ID, or just have some basic knowledge or understanding of your health and what's going on with you. Okay, and I'm not relating any of this to people with dementia, have Alzheimer's, the elderly, if you have a caregiver or have a problem in this area. However, if you are a caregiver for someone and one of your roles is to administer them medication, it is important that you get familiar with what's going on with them and what you're giving them as well. And it doesn't matter if it's your grandparents, a family member, your neighbor, or a friend. It's important to know what's going on with the person you agreed to step up and help care for. Okay? Um, Last but not least, another thing that I would like to mention is please stop taking other people prescribed antibiotics to treat yourself. Okay? Please stop taking other people prescribed antibiotics to treat yourself. Why? Because all antibiotics don't work the same. All antibiotics won't work against all infections or other problems. For example, that amoxicillin that a doctor may have wrote your child for ear infection about 6 months ago probably won't work or be effective if you give it to your child for treating flu-like symptoms or a cold or something, which is a virus. Antibiotics doesn't work against viruses, okay? Or antibiotic that was prescribed for your grandmother to treat her bronchitis probably won't work for your abscess or toothache. So just go seek out proper medical attention so that they can give you the right medication for the right problem if needed. Okay? So thank you all for listening. That's all I have to say. Take care of yourself and be blessed. Thank you.